So how do you know if you're in perimenopause? So are you in your 40s? You may also be in your late 30s. Are you starting to experience menopausal symptoms? Vaginal dryness, low libido, weight gain, insomnia, mood swings? Are you having difficulty concentrating because of brain fog or short-term memory issues? Are you having hair loss or hair thinning, noticing changes in your skin? Are you having dry eyes? Are you more irritable lately? Are you not sleeping through the night and waking up? Are you having urinary incontinence? So these are all very common menopausal symptoms to kind of evaluate for yourself. And then also when it comes to your cycles, have you noticed any changes in your flow? Has it become heavier or lighter? Do you notice more spotting? Do you notice a change in color of the blood that comes out every month? And then how frequent are your cycles? Are they still regular? Or are they changing, whether you're having 2 cycles a month, or are you skipping months in between? So these are all signs that perimenopause is occurring, especially between the ages of, let's say, 35 all the way until 52. So there's a wide gap of a time frame in which that can occur. And then another way to kind of investigate this is to do some lab testing. So on days 2 or 3 of your cycle, you can get a follicular stimulating hormone test and a luteinizing hormone to gauge what the communication is from your brain to your ovaries. The higher the FSH and LH is, the more likely or closer you are into menopause. And usually some doctors say above 10, some say above 25. So you can kind of gauge that. And then also your estrogen levels. You can get a peak estrogen on day 12 of your cycle and a peak progesterone on day 21 of your cycle. So for my patients, I'll have them do 2 blood draws in the month to kind of give me an idea of where they are as far as the hormone production. Now, for women that have irregular cycles in perimenopause, there's a special test called the Dutch cycle mapping test. And that's a test where you collect these dried urine samples for an entire month, and the lab will then map out all of your estrogen and your progesterone. And that's helpful because if you just take a blood test, which is commonly done, especially in my practice, we may miss the actual peak if you're not just consistent as a normal cycle should be. So I have, and most often do, use that cycle mapping test so we can get an exact idea of what's happening all month long with your menstrual cycle. So those are very common things that you can investigate for yourself to decide, or help your doctor decide where you are in perimenopause.